her, you will know why I think she is the best person to run a pharmacy. Let me introduce Zarina.
Thank you, Hussein, for introducing me. That's so nice of you. Yes, thank you. We are located under the same roof as Aafiyat Medical Center. And as Hussein explained about our services, that we try to provide the best services of Zcan Pharmacy. One of the best service I would say is best patient care. How do we make it different from other pharmacies is providing best patient care is, first of all, we are conveniently located under the same roof as Aafiyat. So it's patient's convenience. If your family doctor is under the same roof as Zcan Pharmacy, for example, in Aafiyat Medical Center, then we can communicate with your doctor regarding your prescription needs very easily, and we can make your medications reviews, medications needs very easy and smooth for you.
So you mentioned about how it is convenient for the patients for it to be under one roof. So it's not only that when the doctor actually prescribes and then it's easier for the patient to pick it up, but also, let's say if a doctor prescribes something and the pharmacist thinks that there is a better alternative than this, or a cheaper alternative than this, or something which is better covered, then at that same time the pharmacist can go and have a conversation with the physician, change the prescription, and perhaps help the patient take a better or a cheaper drug. Is my understanding correct, Zarina?
Yes, Hussein, that's correct. So we do that. We try to find the alternative, seeing personally to doctor while the patient is in the clinic and in the pharmacy area, and we make it convenient for patient to make it faster and process it faster, and try our best to deliver it faster. Unlike you go to the bigger stores, and if let's say there is some discrepancy, or the medication needs to be changed, or the brand needs to be changed, or the dose needs to be changed, it's very difficult for a patient or the other pharmacy to communicate with your family doctor who are located in the same roof as Zcan and Aafiyat Medical Center. It will take longer processes for prescription change or medication change or dose change to communicate with doctors at your family clinic in Aafiyat coming from outside, then doing it from Zcan Pharmacy. So that's the convenience we are talking about. Other thing we can do is, let's say for example you are going on a vacation and you remember today, oh, tomorrow I'm going on a vacation and I don't have any medications left. Now I need a new prescription. How am I going to take care of that? Okay, if you are at Zcan Pharmacy, what you can do, you can just give us a call, let us know that, oh, this is the situation I'm in, I'm going on a vacation tomorrow and I don't have any medications left, I'm going away for 30 days. Can you please connect with my doctor at Aafiyat Medical Center, who is my family doctor there, and ask them if they can renew the prescription for us, or if they can give me some vacation supply for me. Yes, we can do it for you. At your convenience, you're sitting at home, just phone call away, we can do it for you. We can connect with your doctor, get the prescription refill, prepare your medications for you, keep it ready, you come and pick it up, or we can deliver at your doorstep at your convenience.
Thank you, Zarina. Thank you for providing this kind of service, personalized service. But let me remind you out here, you shouldn't just suddenly remember you're going on a vacation tomorrow and call the pharmacy for an extended supply of your drugs. It puts a lot of pressure on the family physicians, which we actually have. We do that, and yes, the pharmacist plays a very critical role in helping that. So in a few emergency situations, that is kind of understandable, but as a patient, you should be on top of your drugs, and you should be in time for your prescription renewals. Make sure that you meet with the family doctors, set up appointments, so that you don't have to leverage this additional care which Zcan is providing. But of course, if you have to leverage it, it is available.
I agree with you, Hussein, 100%. completely. This is only in emergency situation. Other convenience I will be talking about is we are open 7 days a week, which is very convenient for the patient. Sometimes it's difficult when you are in emergency situation to find pharmacy close to your house which is not open, especially on Sundays or Saturdays. We are there for you.
Open 7 days a week, open extended hours. One thing which I feel, which you're not talking about, is that even if you have another independent pharmacy or a corporate pharmacy which you're using, you could, and your family doctor is not under Aafiyat Medical Center, Zcan can still provide the best possible service even in that case. And I have seen you do that. I have seen you go over and beyond for not only Aafiyat Medical Center patients, but patients from outside the clinic. Can you help us understand how you do that? I've had fantastic reviews from the patients about that. Can you help me understand how?
Yes, so I'll give you an example on that. That we had one patient who just got out of, I don't know what to call it, the hospital discharge, right?
Yeah.
So sorry, I'm
Who
sorry.
was discharged?
Was just recently
Yes,
discharged.
it is.
Yeah. Can you just do? Yeah, sorry. Yes, Hussein, I will give you an example of that one of the patients just recently discharged from hospital, and it was one of the Sunday afternoon, and the patient was waiting in the car, who was not comfortable sitting in the car for a long period of time, and the patient wanted to go home. The wife came in the pharmacy with some prescriptions, and they needed that medication very quickly, and so I just gathered, or my staff gathered just some information from the patient's wife, what was necessary and needed to process the prescription, and we offer wife to drive the husband home because he was not. I don't know what to say. I'm so sorry.
He's not feeling well.
Don't be under any stress. Everything is gonna be edited, so don't worry about it.
Because he's not feeling well.
He was not feeling well and not in a condition of sitting in the car for a long period of time. So right away we offer that you can go home and take care of him, and we will prepare the medication and we'll bring it home for you. So we delivered the medication in no time to the patient's doorstep, and patient was very happy. Patient was extremely happy that we provided that comfort and convenience and that service which they needed the most in that crucial time of the patient's health.
Just a few moments ago, we were talking with Salim, and he mentioned transparency as being absolutely important. I was wondering, do you inculcate transparency in Zcan? Is it possible for the patients to have a look at their drugs, which, especially if they have healthcare, which were actually prescribed and which were actually dispensed? Is there a transparent history available?
Yes, Hussein. So there is a transparency in our system at Zcan. What patient can do is they can download the app, which is Pharma Connect, connecting to Zcan Pharmacy. Once they download the app, they can add their family members. They can also add their dependents if they have parents, any children, siblings, spouse. Once they register on the Pharma Connect app at Zcan Pharmacy, they have capability of seeing all their medications history, which medication is processed, which medication is available for refills, which medications are no refills left. If they have some refills left in their account, they can see that history in their account. They can even process that refills at the time they need the refills. It's like basically they can do the online shopping through the Pharma Connect app connected by Zcan Pharmacy. They also have visibility to see which particular medication has been processed through their insurance, or even though they don't have insurance, they can see the history of all the medications list, which one they have taken, how many quantity of medications has been dispensed, how many quantities remaining. Same thing, they can have visibility for their spouses, for their children, any dependents, any parents they want to connect through the Zcan app as a family member. They can add multiple family members to that, and they have all the visibility, so there is no fraud involved. There is all the history there. They can also see all their future medications. So this way everything is at their fingertip. At the same time, you know that what we are doing, what we are processing in the pharmacy, and you are also aligned that we are on the same page as what we are informing you. It's all.
Wow, you have so much going on in your app, convenience, shopping, transparency. I'm sure this must be expensive, right? So do the patients have to pay a premium to get access to all of this, or how are your prices compared? Let me remind the listeners out here. When I was talking with Salim, he said that the drug prices are government controlled in Ontario, and the only way the pharmacists tend to make money is by the dispensing fee. So are dispensing fees high? How do we compare to everyone else? I think the Shoppers Drug Mart is at $19 or something like that. I'm not quite sure. What are their dispensing fees? Do you have the comparables?
Hi Hussein, yes, you are correct. The drug prices are regulated by government, and they are everywhere should be the same. Pharmacies have their own dispensing fee set. However, our dispensing fee is lowest as compared to other independent pharmacies. Corporate pharmacies have a little bit of higher dispensing fees. Costco's is the lowest dispensing fees. Our dispensing fee is $9.87, which is very comparable. However, we try to help patients by saying low out-of-pocket cost. We try to help as much as we can and try to match lowest possible fees if it's not affordable for the patient. We try our best to keep our prices for the medications as by the regulations for the government. Everything is available for patient to know on the receipt, on the drug receipt. We can explain patients how to see the breakdown of what is being charged, what are the fees, and what are the fees are paid by their insurance or by ODB. It's all available in the receipts, and we can walk our patient through to educate them, to let them know how our pricing works.
So to summarize, we do have amongst the most competitive fees. Apart from it being competitive in terms of the dispensing fees, you are able to find ways to reduce out-of-pocket expenses by getting them with the financial help which certain institutions provide. So you can provide that customer care. You provide home delivery at no cost. You have an app which provides 100% transparency. I think you've done an amazing job for yourself. You should be really proud of that. Now I want to actually ask about ways in which you have helped people save money. Can you give us examples of how a patient has been helped?
Yes, Hussein. So helping patients with the cost of medications, what we do is there are some patients who would like to have brand name medications. However, most insurance companies and ODBs are not accepting brand name medications cost. They force us to sometimes use generic when possible to process to benefit patient and the healthcare system. So, however, some patient says, no, I want brand name. What do we do? So, we have a certain brand name card so we can use to lower down the cost for the patient if their preference is to use just the brand name medications. That way it will help them with the brand card. It helps patients to lower down the cost of medications, and it will be affordable for them to pay out of pocket cost by using that brand card for them. Particularly, we do that at the pharmacy, at Zcan Pharmacy. Now, other thing we have started using is helping patients who cannot afford medications at all. They have no insurance, they are not capable of getting into the ODB or training program. they are not in that criteria, and they have certain medications they have to take it regularly. It's ongoing medications which they cannot stop, and they are not able to afford. What can we do? What we are doing is we are trying to help them by lowering down or dispensing fee for them, or sometimes taking off completely for them to help them out continue their medications for their best health. Some of the medications are they should not be stopping, and because of the cost, because of not having affordability, they come to us and say, no, I am not able to afford, I don't want to take that medications. We are here to help them. We help them, and we try to digest their cost by not charging them any dispensing fee or charging lowest minimum dispensing fee. Drug cost we cannot play around. It's because it's regulated by government. The only way we can help is with helping lowering down dispensing fee. So that's what we do. We also help the organization called NISA Homes. The NISA Homes is the organization which helps abused women and kids. Some of the women, they do not have the coverage for medications, and they come to us, they come to the pharmacy for medications, and they are not able to afford those medications. So what we do is we try to help them. We pay for their medications, and we are looking for also organizations who can sponsor these type of medications cost to help this NISA Homes. These are women and kids shelter, and they also need some help. So we try to help them through the medications. I don't know what
Yeah, that's it.
That's it?
Yeah, that's it. Okay, through the medications. That's it.
No, I should say by providing them free medications. Would you be able to change that? Yeah.
The ending?
Yeah.
Just say it again.
We try to help them by providing free medications.
Thank you, Zarina. Thank you for that insight. It's so. I feel your energy. I feel how much you care for people. I see that especially women and abused women shelters. I can see that in your eyes when you're talking about how you can actually go over and beyond. May the Almighty give you lots of reward for this. I know you're not doing it for any reward, but just helping out the community is such a big thing in your heart, and I'm so glad that you've made your home under the Aafiyat Medical Center umbrella, and we are able to help the community do all of this. So let me summarize everything so far. So Zcan stands for the 3 pillars of pharmacy, which is, we have complete transparency. We go over and beyond reducing cost for their patients. They have personalized care. That means that they things like home delivery. One part which we did not speak about is how an independent pharmacist provides one-on-one consultancy, and why is that so important, or is it very important when it comes to a patient taking drugs, and how is it different from what others actually do? Is there a place where you go over and beyond what is actually required out of you?
Yes, Hussein, that's a good point and a good question. Yes, we do that. We do provide personalized care to the patients. We spend one-on-one time on patients who are on certain medications and ongoing medications. Our pharmacists sit with them and discuss about their medications reviews. What are the medications should be taken at what time and with what to have the most effect on their diagnosis. We also review their extra care, what is important to take with their medications in terms of vitamins and minerals, which can help them boost their immune system, as well as it helps them with their conditions. We also provide compliance packs. We make them in a way that some patients, let's say for example, they have 6 medications and they have to take those 6 medications during 4 different timings during the day. Now, not everybody will be able to remember to take the same medications at the same time, or certain medications on certain time. They might forget afternoon medication, they might forget the evening medications, or they might mix up morning or afternoon medications. That is absolutely not a good idea. They are not doing purposely, but it can happen, accidents can happen. So what we do is we organize their medications in a compliance pack in a way that morning, afternoon, evening and dinner time medications are prepared for the patients. They just have to open the pack, just pop out the pills and take it with water or food or meals. And all the instructions are there, all the pictures of the medications are there, what time they have to take it is there, everything is there at their fingertips. Like they can just sit and relax and use those compliance pack for their medications, for their day-to-day routine life. They don't have to worry about it. We take care of it all in the background and we keep it ready for them.
A compliance pack is such an important tool for the patient, because it just makes it so easy and medications available. So I'd like to summarize right now. What are the top few things which differentiate you from other pharmacies? Let's keep it short and simple, and let's wind up the podcast after that.
Okay, so Zcan Pharmacy is different in a way that we do the best patient care by doing one-on-one patient care, medications reviews. We help them with training with glucose meter, blood pressure monitor meters, or any diabetic education. We provide them the details. Compliance packs we can prepare for them at no extra cost. We do home deliveries. We are conveniently located under the Aafiyat Medical Center, which is another convenience. We are open 7 days a week. We also have a compounding lab, so the medications which are not readily available we can prepare for the patients as for their convenience.
That's it, folks. You heard from the managing director of Zcan Pharmacy. She does all of this. Next time I talk to her, I want to discuss the compounding lab, because I've actually seen that for myself. There was a Tylenol shortage in Ontario just a few months ago, and people were desperate. People were crying for Tylenol. And guess what? The only pharmacy which I know carried it was us, because they were making that in the compounding room themselves. At that time, when I saw that and I saw the patients get benefit, at that time I was so blessed to have Zcan under my roof, and I'm so blessed to have Zarina working with me to provide the best health care for the patients. We want to make sure that we continue your efforts. In case there is anything which I can do as the managing director of Aafiyat Medical Center, please let me know. If there's anything which Zarina can do, please let me know or let her know directly, and then I will make sure that that information gets passed on. You are the reason why we do this podcast. You are the hero in our story. Let us help you. Thank you.
Thank you, Hussein, and thank you everyone for giving us the opportunity to let us know that who we are. And we are looking forward to see you, and we are looking forward to be with you and help you, to providing you best patient care.